Hi, Dr. Randy Grill, nursing home dentist. Kissing your dentist goodbye is a oral care program philosophy of getting rid of the dentist. This is a program that can stop decay, stop the gum disease in its tracks, and under the supervision of a dentist. And I put that under the supervision of a dentist because I don't want somebody going wild. This program and me are against the damages that bleaching do. It's against the Diet Cokes with near acid content in them. The same with fruit juices, just destroy people's mouths when they come into nursing homes within 6 to 12 months. And so this program is not for everybody. And the reason I'm putting this on there, before I hire a hygienist, I'm considering it. My biggest problem is I need them to understand this type of healing philosophy so that they can enable people to do it themselves. Now, I've probably got 20% of my people that can follow this Kiss Your Dentist Goodbye program. Of those 20%, maybe one family will get involved and help them do this. Because like I went out to Walgreens yesterday and this was $28 to get everything on the system, and we still don't have the xylitol. There's xylitol gum and different things like that. Xylitol will change the bacteria in your mouth so they don't secrete the acid that dissolves the teeth. So this system, if you go to drecoaching.com, do a word, it will explain the whole system to you. I'll go over it real quickly. This is more like a book review, how you can stop seeing the dentist. When I go to the dentist now, they basically evaluate my mouth every 18 months to 2 years. Because of this system, I don't need to have cleanings. I have them go, in fact, I give them instructions. Don't you dare use that rubber cup hard and take everything off. But they always want to do bleachings and stuff like that. Man, I'll get hair plugs before I bleach my teeth. So, because I know the damage that it does. So if you go, do a word search in Google or Dogpile for Dr. Ellie, E-L-L-I-E, Phillips, P-H-I-L-L-I-P-S, or go to drecoaching.com. She's got a bunch of other websites. Go to YouTube. She's got video after video. drellie.com. She's got Zellies.com, Z-E-L-L-I-E-S.com, or where you can get the real xylitol. Some gums claim xylitol, but they use sorbitol for the sweetener, which is worse than sugar. It'll destroy the teeth more than that. So, for you doctors that are interested in this, especially the new ones, I direct every doctor to Dr. Ellie. You can go to her website, drellie.com. Go to the news and then go to the dentist, and there's an hour-and-a-half CE course you can get credit for on the TV ed, dentaltved.com. dentaledu.tv, and just look up Dr. Ellie Phillips. It's minimal invasive options for high-risk patients. So, why am I all excited this for one or two patients? Well, my bariatric patients that can't get out, that can't floss, this system involves oral hygiene and eliminating the dentist, except for evaluations. Now, don't take it and say you're eliminating the dentist. He or she still needs to evaluate you to make sure that what you're doing is correctly. One change in the system, buying it's got the Crest regular paste. If you get the Colgate or one with stannous fluoride in it, you've opened a whole bunch of problems. So it's got to be this exactly system. So you use Crest, you use ACT, but it's the anti-cavity treatment, the alcohol-free mint. Don't get the total. They're putting all these chemicals in here that actually hurt enamel, acids. And then the Listerine Cool Mint, the old Listerine, antiseptic, not the total or the recall or the recalcification or any of those. It's just the old Cool Mint Listerine antiseptic. She's got it all in there. And Closis is a chlorine dioxide, and it has nothing to do with chlorine. But this is incredible. And what you do, you take 2 to 3 minutes, you pour just a little bit. You don't have to pour the recommended amounts in. Do much less. Put this in your mouth. Walk around. I'm talking to you, not our patients. I would have some of my bariatric patients, if they have family help, and they can have this in their room. We know they can't get out of bed. Right before bed, it's best 2 times a day, morning and evening. 2 times a day, but I know I'm only going to get it once, even on the faithful. So you do a little bit of chlorine dioxide, you put it in your mouth, and you walk around the house, or you sit there, watch TV, swish it around, and if you're bedside, the same cup that was poured into there, you spit back into it. Now, you brush your teeth, and it's best with stannous, or with sodium fluoride, and it's best with this exact crest, regular pace, cavity protection, none of the junk, no whiteners, no tartar control. Those dissolve the enamel and make your teeth soft. So then you brush your teeth regularly. Watch my modified Bass brushing. Preferably you can get to the sink, but if you can't, that's okay. Use it even without the stannous fluoride. Then, and this closest, what that does is that neutralizes the acid in your mouth, so when you brush your teeth, it doesn't wear your enamel away. I have known for years that when I have a glass of wine, no way, or if you're bulimic and you have GERD and you burp something up, don't you dare brush your teeth without getting it basic, without rinsing for 2 or 3 minutes on cloci or one of the chlorine dioxide rinses to make your mouth basic, or you're going to take that toothbrush and you're going to scrub your enamel away. That's why many of you have thin enamel. Or you eat an acidic food, like cold apple juice is almost battery acid. So you use the closest, 3 minutes, you brush for a minute with stannous fluoride, spit it out in the same cup you've got it in. Now let's take the Listerine, just a half a cap, you don't need a whole lot, and do that for a minute. And that, every dentist knows these things work. And that takes care of the bacteria in your mouth. Swish it around for as long as you can stand it, 30 seconds to a minute. Spit it out in the cup. And now you go to the Alcohol-Free Act Anti-Cavity. And what that does is it takes the acid away. If you just use Listerine, it's acidic. It's going to dissolve your teeth over time. So you go to the Alcohol-Free Act, the regular anti-cavity fluoride rinse. It's basic. It'll neutralize what Listerine has done. It killed the bacteria. Now you're going to neutralize it, and small fluoride ions are going to go in there and remineralize. So, and the other part of it is having xylitol mint after every snack or after every time you eat. And you almost have to go to Zellies.com, Zellies, I believe, Zellies.com to get the right or true xylitol. We get xylitol powder at the health food store, but the true mint, some of them cut back on that, but Zellies is committed to the quality of getting you that. And these Zellies change the bacteria content in your mouth over time, and you will be a new person, and you will find at your checkups no more decays. And if you have decay, this will actually stop. This is based on cariology. It's well documented. Dr. Edwina Kidd with MID and ART, the late Dr. Jane Chalmers. I look at Dr. Phillips as an extension of the work Jane Chalmers was doing at the University of Iowa, and what a loss that was. So whether you're a dentist entering this system, a hygienist, you better know that this can happen, because you can't do a lot of fillings on some of our patients. So this is one of our only options, and while they're awake and alert times 4 or maybe 3 and they have family help, this may work. But hygienists, don't you dare go scraping everything off without the knowledge of what Dr. Ellie Phillips has for you in this book, Kiss Your Dentist Goodbye. Take the course, read it, and I'll talk to you later. Thank you. Dr. Randy Grill.